I wanted to write to you, review the laboratory tests. The complete blood count did not reveal anemia. The complete blood count is a simple blood test that measures the number of red blood cells, white blood cells, and platelets in the blood. It can check for anemia. It is a common test that is often used as a screening test that gives a picture of a person's overall health status. It can be used as the first step to screen for a wide variety of medical conditions, including inflammatory diseases. You would need to check the complete blood count before starting medication. The chemistry profile. The chemistry profile was without electrolyte abnormalities. This measures a variety of chemicals and enzymes in the blood. Enzymes are proteins that are involved in the body's chemical reactions, and they provide a very general information about the status of organ health and function, especially the liver, kidneys, and pancreas. This profile includes the levels of sodium, potassium, chloride, carbon dioxide, calcium, protein, liver function tests, and blood glucose. We would need to check the chemistry profile before starting any medication. The serum protein electrophoresis was normal. This is a laboratory test or examination of protein levels that commonly used to identify patients with multiple myeloma and other disorders of serum protein. Elevations of these proteins have been found in persons with joint. The anti-neutrophilic cytoplasmic antibody, or ANCA. This was negative. This is in the blood test is used by doctors to help the diagnosis of autoimmune disease. It's commonly elevated in patients with granulomatosis, with polyangiitis, and Churg-Strauss. Elevations of the antibody may be found in patients with joint pain. The uric acid level. This was normal. The uric acid blood test, also known as the serum uric acid measurement, determines how much uric acid is present in your blood. The test helps determine how much your body produces and removes uric acid. Most uric acid is dissolved in the blood, filtered through the kidneys, and expelled in the urine. Sometimes the blood produces too much uric acid or doesn't filter out enough of it. Hyperuricemia is the name of the disorder that occurs when you have too much uric acid in your body. High levels of uric acid are associated with a condition called gout. Gout is a form of arthritis that causes swelling of joints, especially in the big feet and toes. The CPK, or muscle enzyme, was within normal limits. Creatine phosphokinase, also named as CPK, creatine kinase, or CK, is an enzyme which is also that is found in your heart, brain, and skeletal muscles. An enzyme is a protein that helps to elicit chemical changes in your body. When muscle tissue is damaged, CPK leaks into your blood. Therefore, high levels of CPK usually indicate some sort of stress or injury to your heart or muscles. Elevated CPKs may be associated with muscle aches. The C-reactive protein. This is an index of inflammation and was normal. When there's inflammation in the body, the liver produces a protein called CRP. A high CRP level indicates an inflammatory condition, including infection. For this reason, a high CPK is not necessarily a strong indicator of rheumatoid arthritis specifically, but can support this diagnosis. In addition to using CRP lab tests for diagnosis, doctors often use this to monitor a patient's response to treatment. Serum ferritin. The serum ferritin was normal. This is a blood test that helps your doctor figure out whether your body's using too much protein. It can be found also in alcohol abuse, infection, liver disease, rheumatoid arthritis, overactive thyroid, some types of cancer. Altered levels of ferritin may be associated with aches and pains. The serum ferritin also is a measure of how much iron is stored in your body. It can be a marker of inflammation. When your iron level is low, your body will pull iron out of storage to use. The iron levels were normal. An iron test may show if you have too much or too little of this mineral in your system. It can check for conditions like anemia, iron excess. Elevated levels of iron may be associated with arthritis. There are several different tests for this, including the serum iron, total iron binding capacity, and unsaturated iron binding capacity. The TSH. TSH was within normal limits. A thyroid stimulating hormone, or TSH, is the amount of TSH in the blood. TSH is produced by the pituitary gland, which is located at the base of your brain. It is responsible for regulating the amount of hormones released by the thyroid. Elevated levels of this hormone may be associated with iron, aches, and fatigue. The vitamin D level was within normal limits. This is essential for strong bones. It helps the body use calcium. It is also known as the sunshine vitamin. Vitamin D is produced by the body in response to skin being exposed to sunlight. It also occurs naturally in a few foods, including some fish, liver oils, egg yolks, and in fortified dairy and grain products. Low levels of vitamin D may be associated with aches and pains. The anti-nuclear antibody for lupus was negative. This is a blood test that looks for antibodies to proteins found in the cell nucleus. The nucleus is essentially the brain center of any cell in the body. Many types of proteins are found in the nucleus, and they can be targets for an immune attack. It is a test to see if there are antibodies in the blood that are attacking any proteins that are found in the nucleus. The ANA is a screening test for autoimmune diseases, including rheumatic diseases and non-rheumatic diseases. It is not specific to a single disease. A strong positive test makes it likely that a person has an autoimmune disease, but it does not distinguish between different types of autoimmune disease. If the anti-ANA is positive, then there are clinical features of an autoimmune disease, other more specific tests will be ordered. After the blood is drawn, it is sent to the lab where it is diluted with saline and tested for the presence of anti-nuclear. The rheumatoid factor was negative. A rheumatoid factor measures the amount of rheumatoid factor in your blood. These are proteins produced by our immune system that can attack healthy tissue in your blood. It looks for antibodies called rheumatoid factors, and these are autoantibodies that are produced by the immune system that can attack a variety of healthy tissues. The test is usually ordered in a patient suspected of rheumatoid arthritis or other rheumatic diseases. It's not very specific. In the early stages of rheumatoid, about half the people will have a positive rheumatoid factor, and the other half will have a negative rheumatoid factor. So having a negative rheumatoid factor does not necessarily rule out the diagnosis of RA. In established patients with rheumatoid arthritis, 75 to 80% will have a positive rheumatoid factor test. The test can be helpful in diagnosing rheumatoid arthritis, but since not everyone with RA will test positive, doctors interpret the results in the context of a person's other signs and symptoms, as well as the results of other tests. The AntiCCP for rheumatoid arthritis was negative. This is an antibody present in rheumatoid arthritis. Levels of this can be detected through a simple blood test and can be used in conjunction with other blood tests and imaging studies. It is a blood test that looks for anti-CCP antibodies, also known as anti-citrulline protein antibodies, or ACPAs. These are a type of an antibody, autoantibody, which is an antibody produced by the immune system that targets something. The ACPs target a joint protein that is called citrulline protein that can be found in some people's joints. It's helpful in diagnosing rheumatoid arthritis. These tests are present in 60-70% of people who get RA. Since not everyone with RA will test positive, doctors interpret the results of this test in context with their patient's symptoms and results of other tests. The SSB and SSA were negative. These are antibodies found with Sjogren's syndrome. Sjogren's syndrome is a condition characterized by dry eyes and/or dry mouth. It is used to support the diagnosis of Sjogren's. Approximately 70% of Sjogren's patients are positive for SSB and 40% for SSB. This is a blood test that detects human autoantibodies to the nuclear antigens. Sjogren's syndrome can be accompanied with aches and pains. Additional tests. If you're continuing to have aches and pains and would like to obtain laboratory studies for celiac antibodies, Saccharomyces antibodies for possible Crohn's if you're having diarrhea or abdominal pain, Lyme's titer if you have had any insect bites or traveled to a wooded area, a chest x-ray for possible sarcoidosis, and to explore for other types of other arthritis. In addition, I'd like to consider sonograms of hand and look for further information. Now the Vectra score was done. This is a test that helps with determining the level of inflammation in your body. The level of the score can help with predicting possible radiological progression of joint damage with rheumatoid arthritis and inflammatory arthritis. Low disease activity, or less than 29, has a 0% chance of radiographic progression. Moderate disease activity, 30 to 44, comes with 3 to 0.4%, and high disease activity greater than 44 score may come with 20.9 radiographic or joint damage. Your disease activity was low. If the joint swelling persists, we may need to consider additional medications called DMARDs. But that would require further discussion. Thank you.